Hi, everyone. Welcome to Camille's Holistic Health Show. I'm Dr. Cam, and today we're going to be talking about getting our minds around mental health and the 6 essential facts about bipolar disorder. And if this is a video of interest to you, go ahead and subscribe to my YouTube channel. Hit that bell to get notified every time I have a new video coming out. Okay, so let's begin. So a recent survey said that American Psychiatric Association found that many people know little or almost nothing about warning signs of the causes and the effects, treatments, the effective treatments of mental illness. Even though in any given year, 1 out of 5 Americans suffer with a diagnosable mental disorder. And each year, more people suffer from a mental illness than from cancer or diabetes combined. So, research has also shown that mental illness or mental illnesses are caused by genetic and environmental factors, traumatic events, and other physical illness or injury. And yet, 1/3 of Americans mistakenly believe emotional or personal illness is a major cause for common mental illness. And almost as many think that it's due to old age. And that's a major cause, is what they believe. As a result, many Americans may not get the help that they need because they're actually misinformed, and like changes in personality, inability to cope with problems and daily activities, marked changes in eating and sleeping patterns, and extreme highs and lows. These are just some of the warning signs of mental illness, such as depression and anxiety. And a great majority, about 84%, said that they know, they would like to know more about these identifying, warning signs. By learning more, you may be able to help someone, okay, whether it's a friend or a family member who may be suffering with mental illness and lead, you know, a healthier and happier life just because of knowing, having knowledge, because knowledge is power. So we're going to go into 6 essential facts to know about bipolar disorder. Okay, so mental health authorities estimate that more than 2 million adults, it's probably higher now, have been diagnosed with bipolar disorder, also called manic depression. And it's really a chemical imbalance in the brain causing extreme mood swings from manic highs to agonizing lows. Okay, so although a diagnosis of bipolar disorder can be frightening and confusing, it is treatable and manageable, and people can actually live um, a very happy, healthy life. So if you have someone like I had mentioned, who has been diagnosed with bipolar illness, the first step is actually uh, relieving that fear and uncertainty in education, because that's really the key. The more you know about mental health and the disorders like bipolar, the less control it will have over that person's life, and they will be affected in less of a way that they'll be able to control it better, manage it better, and live a better, you know healthier lifestyle. Okay, so you know here is the 6 facts of bipolar disorder. Number 1, bipolar disorder affects many people, as we know. And according to the National Alliance of Mental Illness, bipolar disorder affects 2.3 million, probably more, or 1.2% of the population in any given year. Okay, so number 2, evidence suggests that many components may come into play, and all of which is due to chemical imbalance of certain parts of the brain. Number 3, it is often genetic component, okay, towards this illness, and it could often be included other factors like traumatic health um, issues or events, chronic illness, alcoholism, or drug abuse can come into play. So number 4, bipolar has mood swings from high manic episodes to debilitating episodes of depression, and then back again, like a cycle, with relative normal moods in between. And number 5, the behavior during manic episodes can include heightened feelings of euphoria, extreme energy, distractibility, extreme irritability, um, decreased in sleep, and oftentimes they have low extreme energy, like I mentioned, and depression. That's the other part. These episodes include hopelessness, worthlessness, guilt, excessive feelings of despair, and thoughts of suicide. So, it affects, bipolar often affects both sexes, male, female, including all ranges from children to adults. And just to name a couple more facts, the majority of these diagnoses, the bipolar has at least one member with this illness, and it can often be treated with mood stabilizers to assist and control the fluctuations of these mood swings that one will have. Bipolar is definitely a lifelong disorder, and recurring illness requires ongoing care, from medication to psychotherapy. And psychotherapy really assists these people with these illnesses by developing coping skills to help deal with life events and stresses that may actually trigger the manic and depressive episodes. So bipolar, it really has no cure. There, it's unknown as of today, but it's very treatable and very manageable illness. So definitely, if you have someone that that is, needing assistance, remember a proper diagnosis is really essential in this disorder. They need to adhere to different medications that they're on and stick to it, and have a prescribed treatment plan for having a more productive and rewarding life. So these are just a few facts pertaining to bipolar disorder. It is not a simple illness. It's definitely manageable and treatable. And definitely, if you have someone that um, that has been diagnosed with bipolar disorder, you know, just don't hesitate to seek the important medical information and help that they need. So I wanted to also say that I um, have a hotline that in case you do need this help or someone does need it. The National Alliance on Mental Illness Um, they actually operate, Monday through Friday from 10 a.m. to 6 p.m. And it is the hotline number is 1-800-950-6264. Okay, and the operators can actually provide information about mental illness and refer callers to treatment and support groups and family support and legal support as well if you need it. So, obtaining the knowledge is one of the first steps to really alleviating, the uncertainty around bipolar or any other mental illness, actually. And it will help you decrease that anxiety around, you know, these mental illnesses and dealing and coping with it. So I really hope you enjoyed this video. Go ahead and subscribe to my YouTube channel and don't forget to hit that bell to get notified because I really have a lot of other videos coming out during the weeks to come. Different types of videos, not just only mental health, but health in general, especially for women who want to overcome chronic condition and other autoimmune conditions with a more holistic approach to their health and wellness. I also would like to invite you to a wonderful 5-day challenge I'm having, Women's Boldly Rising. It is a 5-day challenge that I often put out every month or two to provide, better options for your alternative health, especially if you're going down that path and you're unsure. This is a wonderful support. It includes a Facebook group. It's a free 5-day challenge for those that are looking to overcome those challenges that you've been having for many years. So please, I welcome you. I will have the links below to the 5-day challenge. Thanks so much for watching, and I will see you next time in the next video. Bye now.